So good to see you.
Hi, thanks for having me. Excited to chat a little bit.
Oh, it's so fun to have a friend on our webinar series. We don't get to chat enough, so I'm super happy to have you here and honored that you made the time. So, like I said, everybody, Addie's a good friend of mine. We met, I think, last year and became fast friends right after that. And I'm so excited about the work that you guys are doing and the conversation that we're going to have today. So everybody, meet Dr. Addie Reinhard, my friend from MentorVet. She's here with us today. We're going to have a half an hour discussion followed by a 10-minute Q&A session. So stick around, have your questions ready. So we're going to talk about burnout today. It seems like the over-talked about topic that you've got a chance to talk about a ton, Addie. The impact that it's having on the veterinary industry, how to recognize signs of burnout in yourself and in your team, as well as, and this is my favorite part, practical steps that you can take to reduce stress and improve well-being. So if you're joining us today, we're super happy to have you here. Please use the chat feature, throw in any questions that you have. We'll make sure that we save a ton of time for questions. So I'm your host, Shawn Wilkie. I'm the CEO of Talkatoo, the co-host of the Veterinary Innovation Podcast. You might have heard of Talkatoo. We're a dictation company helping give veterinary professionals time back in their day. We think that we can help prevent burnout with some people that really hate medical records. And I know Addie's tried our product and uses it a little bit, which is really cool. So without further ado, I think we're really gonna jump right into it. You know, Addie, you're an expert, you're a researcher, you're a veterinarian, you're a trainer, you're a coach, you're all of these things. You've been helping Merck with the animal veterinary wellbeing study, and all of these things related to all of this, in addition to being just like an overwhelmingly awesome person that I really enjoy hanging out with. So welcome, good to have you.
Thanks, Shawn. Yeah, I've been excited about this conversation for several weeks now because I feel like our conversations are always quite good. So this will be fun.
The dangerous thing about this conversation is the 30 minutes. So we
got. Are you all ready for a 5-hour conversation?
I know. I feel like our conversation's halfway over and we haven't even started, because typically we get on the phone with each other like it's an hour and you're like, oh, whoa, it's 2.5 hours. So anyways, Addie, let's jump into it. What is burnout? Let's start there.
I think that's a good place to start because I think having some definitions around some of these common terms we throw out all the time is really important. So burnout is essentially a psychological syndrome that emerges as a response to prolonged chronic stress on the job. So essentially, chronic stress at work can lead to burnout, particularly if we're not doing anything to either prevent the stressors or cope with the stressors in a healthy way. And typically it exhibits with kind of 3 main symptoms. So one would be exhaustion. So you just feel tired all the time. You might come into work feeling exhausted already. It's just hard, feeling like you have kind of a lack of energy or you're feeling depleted. It might exhibit as feeling cynical, so cynicism about either your work, cynicism about the veterinary industry as a whole. I see that a lot, and just maybe some feelings of detachment from your patients and your cases. And then the third symptom is lack of professional efficacy, or feeling like the work that you're doing isn't really mattering anymore. And I know when I was kind of in the severe stage of burnout, I definitely felt the exhaustion. I remember telling my mom on the phone that I was feeling mentally, physically, and emotionally exhausted. And it was kind of unrelenting. And then I also felt like kind of like lack of personal accomplishment, meaning I felt like even though I was doing all this good work to help animals, that I felt like the work that I wasn't doing, or that I was doing, wasn't really helping anyone or making a difference. So I think that kind of gives you a pretty good view on what exactly burnout is.
So why does this happen? You know, it seems to be an obvious question, but like, you know, what causes it?
Yeah. And so going back to the definition, so chronic stress at work. So there's quite a few stressors in the veterinary industry. I mean, this is an inherently stressful profession. There are some stressors that are unavoidable and are always going to be within our profession. And then there's some stressors that are avoidable and preventable. But when we look at the veterinary industry as a whole, there's just a slew of stressors that can, over time, lead to burnout. In kind of general burnout research overall, there's several things that have been shown consistently linked to workplace burnout. So things like working too many hours or work overload, feeling like you don't have control. So lack of control over your work situation, your work environment, feeling like you're not getting enough recognition or reward from the hard work that you're doing, conflict or having poor relationships at work. So, if there's conflict either on your team or with a boss or with your clients, that stressor over time can lead to burnout. If decisions are being made that feel unfair, that some people are getting treated more better than others, that can also lead to burnout. And then values conflict. So we all have kind of these core values. Practices kind of have core values as well, and the people in them. And if those don't match over time, that can lead to burnout. And so, for that example, I worked in rural Kentucky. And so I valued providing affordable care to my clients who maybe couldn't afford the gold standard top tier care. And I valued that. And my practice also valued that. So that was a values alignment. But if someone, who really values gold standard care, and that's they want to use all the bells and whistles and the top quality care every single time, they're probably not going to be happy working in rural Kentucky. So there would be a values mismatch there. So any of those things can kind of contribute to burnout. And I think we see quite a few of those stressors within our career, particularly, around like moral stress and those ethical dilemmas that we experience, but quite a few stressors, but that's just a few that might kind of lead to eventual burnout if the stress isn't coped with in a healthy way.
Yeah, no, totally. And I mean, Addie, the first time we ever met was at the Veterinary Innovation Summit last year, 2 years ago. You were up on the stage. You were like making the hairs on the back of my neck stand up as you were telling your story of burnout. So I think it's really helpful for people to kind of like understand context. Like, so what I'm going to ask you is not to maybe share the full details of your story, but how the heck did you end up like as the burnout lady, as the lady that knows everything about burnout in veterinary medicine? And how did MentorVet come about? And maybe just do a little teaser about what MentorVet is, and then we'll jump back into the agenda, which I never follow. Sorry, everybody at Talkatoo. I apologize. All these smart people put this stuff together, and then I just go off script all the time.
I know. I love the off script. And I graduated in 2015 from University of Tennessee, and I practiced small animal for full time for around 4 years. And my moment of burnout, I had one at about a year out, and then I had one again at about 3 years out. And the second time I experienced burnout, I just remember like driving home from work, and I was just, I loved the practice. I loved my team. I had great mentorship, and there were a lot of stressors. And so the ethical stress and just working myself and not setting boundaries for myself of saying like, I need to take a break sometimes. And I was just, trying to help all the animals and all the people. And eventually over time, I got a little exhausted. And I just remember like driving home from work one day, and I had to pull off the side of the road. And I just remember like breaking down in the Walmart parking lot, and just asking myself, why do I keep doing this to myself over and over again? And even in that supportive environment, I was still experiencing burnout. And so I started talking more openly about my burnout. I reached out to friends and family. I seek professional help. I went to webinars and training on, how to cope with some of the stress that I was experiencing. And I got through my burnout. And then I recognized how important having good resources when you're going through those experiences, how important that is. And I recognized that there was this huge gap in the amount of resources that our early career vets had available to them, and talking with other classmates, seeing that this wasn't just a me problem, this was like an industry-wide issue. So I wanted to do something about it. I ended up quitting my full-time job in 2019. I went back to school at University of Kentucky and got my master's degree in community and leadership development. And I spent 2 years researching veterinary well-being, and specifically in the early career, and more importantly, what we can do about it and how we can support veterinary professionals. And then that project was particularly looking at early career veterinarians. So I piloted an intervention in the summer of 2020 at the start of the pandemic. And it's essentially a mentorship and professional development program that helps support vets, not only through peer mentorship and paired mentorship, but also through training and professional skills. We saw a lot of amazing results from that initial research. And so we were connected with professionals at Merck Animal Health who wanted to support what we were doing. And so they became a founding sponsor of MentorVet in 2021. MentorVet was born, and we've been growing rapidly. So we had about 75 early career vets in our program in the fall and around 150 this spring. We have over 100 mentors within our community, and we're growing, doubling in size every 6 months, which is super cool to see, and just to see the evidence behind what we're doing. So we're reducing burnout and really seeing a good impact on this program. So yeah, that's what I've been up to the last few years. Oh, you're on mute, Shawn.
Oh, look at you. You're so good at this. So just a little bit, you've been up to just a little bit. So the really interesting thing is, like, people have heard this quote all the time, which is lonely at the top, right? And so as a veterinarian, you're kind of at the top of the food chain of a veterinary hospital. And so I got to imagine that, not feeling like you have somebody else to support you can really contribute to burnout. And this idea of MentorVet, where you're paired up with somebody that's been there, that's done it, that's been through the stress, that knows how to deal with it in a healthy way, has to be having a major impact. So what have people said that have gone through MentorVet that were kind of like right at the start of being burnt out before they entered the program?
Yeah, we have a lot of like really sound like research data and like all the statistics but I think the stories for me have just been the most impactful. So we do interviews and we get feedback from our participants that way. And I remember one time a participant through our program, told me she wasn't even recognizing that she was burnt out at the start of the program. So she started the program. We have some training on like recognizing some of these symptoms of burnout and kind of self-care aspects. And through the program, we also teach all these professional skills around communication skills and conflict management and coping with ethical dilemmas. But I remember her telling me that she didn't even recognize that she was experiencing burnout until she went through the module at the beginning of the program. And then she had this moment of like breaking down. Then she went to her employer and told her employer what she was experiencing, and her employer worked together to create the work environment that she needed to thrive. And now she's thriving in practice in that same practice that she was starting at. And so I think it was just like a beautiful, and we see this a lot within our program, is that when we start speaking up about our experiences and asking for help and advocating for healthy work environments for ourselves and others, if we can do this in a collective and all individuals are kind of advocating for this healthy change, I think that's how we are really going to make systemic changes within this profession, because it is hard as a leader to make these changes. Sometimes you don't even know what changes to make until your people are kind of speaking up about it. So I think that that's been one piece that I've really seen this program do is really empowering early career professionals to kind of open up. We create these safe spaces where they can talk about the challenges that they're facing with either their peers or their mentor, and it gives them confidence to then start speaking up with their employers or with others in the industry.
Yeah, that makes tons of sense, Addie. So we've got people on here right now. Maybe some of them are burnt out, or maybe some of them are completely not able to get out of bed, because I know that's what it was like for me when I burnt out, kind of 15 years ago. I wasn't able to get out of bed. I wasn't able to do anything. And we've never had that conversation. So that's another conversation for another time. But it took me moving to the other side of the world, stopping doing everything I was doing in 6 months. And I was, able to kind of go back and start another company. So it can be really rough. And I know all too well what it's like. But let's stop talking about the problem and let's talk about the solution a little bit, because there may be people here that need this message now. So what steps can individuals take to kind of recognize, reduce stress, improve well-being? If there's people here that are thinking, geez, my team has just been so busy and it's like since 2 years of this pandemic, and will it ever end? And, where are all these new customers coming from? And, the questions in VetMed are not, how do we be more profitable? How do I run a better practice? It's how do I keep staff? How do I keep people happy? How do I make sure that my people don't burn out so that they're not looking to leave and go down to a practice down the street? So, I know you've done a lot of research. I know that you've done stuff through the Merck Wellbeing study, but what are the top 10 things? What are the things that people need to know that are here today?
Yeah, so I think you hit on two very important pieces of this puzzle. So one, individual strategies, and two, organizational strategies. So if we are going to make an impact on burnout, we have to have both the individual and the organizational strategies. And so I'll start with kind of the individual side of things. So these are things that you can start doing today to support your own mental health and well-being. So the first thing, one of the most important predictors for good mental health and well-being in the most recent Merck Animal Health Veterinary Wellbeing study that I was a collaborating researcher on last year. So one of the most important positive predictors for good mental health and well-being was feeling like you have a healthy way to manage your stress. So today, sit down, write out your stress management plan. What are the things that you do that help you cope with stress, and write some of those things down, develop a plan. I know when I'm starting to feel overwhelmed and stressed, and I still get overwhelmed and stressed even in my current role at MentorVet. And I know that I need to reach out to friends and spend time with friends and family. I know I need to exercise. I know I need to probably get a little short meditation in there. I know I probably need to start eating a little bit healthier. So there's things that I know that I need to do. But again, stress management is individualized. So what works for some people is not going to work the same for other people. So really figuring out what it is that works for you and doing more of that and ramping it up at times of stress. And to do that, we have to set healthy boundaries, right? So we have to set boundaries to be able to do the stress management, because we can make this plan, this beautiful plan of how I'm going to manage my stress. But if we are not setting boundaries to say, okay, I'm going to take a 10-15 minute lunch break today so that I can eat my healthy food. You can do that. And just really starting to think about how are you setting boundaries for yourself so that you have time to work on the self-care. I always encourage people to think about self-care, and it doesn't have to be large to be effective. So you don't have to have those huge, lofty goals with self-care. It can be just one small thing a day, like 5 minutes of just sitting and doing nothing and just having some downtime. So really starting small, or when you get home from work, just taking the dog for a walk every single day. So it's really starting small and making these incremental steps to build up your self-care. Getting training and professional skills. So any of the stressors that you're experiencing within the workplace, whether it be conflict with your team, take a conflict management class at a conference. If you are, having issues, coping with some moral stress, take a class on ethics and ethical decision making. So that would be another thing. I think seeking social support from others is huge. So reaching out for help when you need it, seeking counseling or therapy when you need it, and then, like I mentioned before, just advocating for those healthy changes within your work environment, and then engaging in a financial planner. So that was another thing from the Merck study that we found to be associated with good mental health and well-being. So that's kind of on the individual side of things. There's also,
don't go to the organization.
Okay, I'll pause. I'm pausing.
I want to give you a scenario. Okay,
so scenario, go.
This may or may not have happened.
Okay.
But it may have happened 2 weeks ago. So I was in a veterinary clinic, and the veterinary clinic that I was in hypothetical, remember, there was somebody that was celebrating their 25th anniversary working in that veterinary hospital, and they had a really healthy culture. People were friendly, people obviously were friends that were there. There was people that had come in for this little party that was happening during lunch hour. The veterinarian that was being recognized, they bought her some gifts and stuff, and so she came in and she was there celebrating for 5 minutes, and a client showed up that really wanted to speak with this veterinarian about their animal. And she just left the party with everybody else there and went back to work. And so I'm sure there's people on this webinar that see themselves in that scenario where there's something that's happening and they feel like they've got to manage all of these balls. They've got to be there for the client, they've got to be there for the staff, they've got to be there for management or leadership. How do you set boundaries in a situation that seems like just unattainable? Like, what does that look like? How do you even go about doing that in a way that doesn't hurt everybody's feelings or put everybody off in the wrong way? What would you do?
Yeah. And boundaries, like stress management, are going to be individual for everyone. So there's not like a one size fits all approach to boundaries. And one thing I will say is we can't, as veterinarians, take care of anyone else if we don't start with taking care of ourselves, right? So I would encourage, so a lot of veterinarians also have, as one of their top values, compassion, which is great, right? We love animals, we care for people, we're healers. I would challenge you to expand your definition of compassion for others to also include yourself. So compassion as a core value, but also including yourself in that. So making sure that you are taking care of yourself like you are giving to everyone else around you and all the pets and all the clients and all your team. Remember that you're also caring for yourself.
Yeah, because I guess if you don't, eventually comes a point where you're in bed, can't get out of bed, don't know what to do. And it's inevitable, isn't it?
You can't help anybody, right? Yeah. If you're not taking the steps, and it's not to, and I have to be careful here, because if we, I feel, I had a bit of an emotional breakdown at the start of this year because I was putting the weight of feeling like I had to do all the self-care on my shoulders, right? And doing this role, being in MentorVet, helping people, learn how to navigate this career successfully. I felt like there was like this obligation to feel like I had to do the self-care. So it's almost like this heavy weight on my shoulders. And then sometimes though, if we let go of that obligation, work is kind of a flow. So sometimes we're going to be a bit busier, sometimes we're going to be a bit slower, and being able to like ride those waves and realize that maybe sometimes I can't get the self-care in that I would like, and that's okay. And at least I'm making small, tiny steps towards taking care of myself. So again, maybe I just went for a 5-minute walk once a day, and that's still something, right? I think it kind of goes back to it doesn't have to be huge to be effective. We don't have to be, nobody's going to be meditating for 2 hours a day. That's impractical, right? So what are some, practical things that we can do? And particularly if we're looking at boundaries, I think, starting to think about what is it that you value, because that's going to help you set those boundaries even better. Setting arbitrary boundaries is not really going to help you at all, but knowing, hey, I want to leave at 5 o'clock today because I want to go to my kids' t-ball game. And so I'm going to make sure that we make all the steps happen, and I communicate with everyone, and I state that boundary, and it's there. And we know that I'm going to go to my kids' t-ball game and leave this clinic at 5 p.m. It's possible. And it just really helps that if you have that piece of this thing that you want to value, or you have of this value outside of work. And another thing I think veterinarians do often is we wrap our personal identity so closely in with our roles as veterinarians. So I'd also encourage individuals to find who you are outside of veterinary medicine, and have those things that bring you joy in life, because sometimes vet med will let you down, and having those other things, whether it be hobbies or time with family and friends, will keep you going on those really hard days.
Yeah, it seems like a profession, Addie, everything that I know about it, that will take and take and take and take and take and take if you let it.
Yeah.
So I think that makes sense about the boundaries. So what can the organizations do to support people in maybe developing happy or healthy boundaries? And what kind of guideposts can practice managers or senior managers in large veterinary consultators, what can they do to kind of protect their people so they don't end up part of the statistic?
Yeah. So I think there's a lot of things, and we'll probably not get to them all in the next 5 minutes, but a few just things that you can do today if you aren't already doing those things. Things like setting up an EAP. So that's an employee assistance program. So it's so your employees can have free access to confidential mental health providers or anything that they need kind of in the moment as kind of an intermediate. Providing coverage for mental health conditions is also really helpful. I heard the other day, one of the vets I was working with couldn't really afford therapy, and her health insurance didn't cover it. So making sure that the health plans that you provide do cover for mental health therapy and counseling, and then communicating those resources to your team. And I think we have to go a step further. So we can provide all of these external resources, but we also kind of have to look at the cultures that we're creating within our workplaces. And I would say a lot of that's occurring locally. So, we have kind of these larger practice groups, but then we also have each individual hospital that has each individual unique culture. And so I think it's really important that those leaders within those hospitals are getting training on how to lead a team and how to manage a team, because this is not, leadership is not something that comes naturally for most. And if you haven't had any training on how to successfully lead a team, then you might run into issues. So getting your leaders more engaged in leadership training so that you can be a better leader. And then really thinking about how you are providing flexibility and autonomy to your team. So I believe in kind of local solutions. So if your practice is having an issue, talk to your team about it. Ask for their advice and solutions, because oftentimes the people on the front lines might know a little bit more than you as the leader. And so being able to listen to your team and again, starting small. So we don't want to, take on too much all at once, but if there is, one suggestion that comes out of a team meeting that's like really awesome, like let's try that, let's implement it for a month and see how it's going, and then reassess, and then keep adding in these little things and little small changes that our team is kind of creating and developing these local solutions. So I would say that's the big thing. And then also providing mentorship, training, and development to your team. So making sure that you're providing good support for the people, especially coming into the workplace, making sure you're providing plenty of training and development opportunities. So I would say there's a lot more things that we can be doing, but I would say that's some of the ones that come to mind.
Addie, one thing that I'd love to have an hour and a half to talk to you about is something I read the other day. It was a study that was recently done where it talks about, I think Josh Weisman actually posted it, and it was about
psychology. I think I see Josh here, by the way.
Hey, Josh, welcome. Good to have you. So I read that article, and it resonated with me, what you posted on LinkedIn. And what I took from this post was that teams that have conflict and discomfort, that are able to lean into conflict and discomfort and resolve it in a professional way, where maybe there's psychological safety on both sides, end up being the most motivated and highest performing teams. And that is completely contrary to anything that I would think as a leader, where there's a difficult situation, we talk through it, makes everybody uncomfortable, we get to the other side, and we're stronger because of it. So I think a lot of things when it comes to psychological safety, mental health in the workplace, I think a lot of these things are super duper uncomfortable, and we want to get away from them. It's uncomfortable. We're like, maybe we'll just push it under the rug. But I think there's a lot of new research coming out that says if you lean into those conversations, if you have them, if you make safe space to have hard conversations and get out the other side, you come out victorious and stronger than you went into it. So I wondered if you could maybe talk to me about that a little bit. Addie, what do you think about that?
Yeah, I think building psychological safety sometimes takes time. It takes time to build trust on your team, but just having an environment where it's okay if mistakes are made, right? Mistakes are part of being human. And I remember a few times throughout my career, like getting kind of yelled at for making a mistake. And that doesn't make you want to bring up things within your workplace in the future. Or I remember one time I had an idea for something and I brought it up to my supervisor and just immediately shut down in that moment. Like, no, this is never going to work here. We aren't even going to really consider this idea. So I think it's about, as a leader, being open to the ideas that your team has, and your team, they like, if they're engaged in the workplace, they want to help make it better for everyone around. So I think really being able to listen is really important. And then taking those little tidbits and at least acknowledging the idea, appreciating the idea, and trying your best to implement some of the things that your team is suggesting. But again, I think that's a whole nother
So true,
hour
Addie,
conversation
like,
that we're going to have. So
I know it's like we just have the six of them here. We should have like a 3-hour webinar. One of the things that resonated with me as a leader, you know, I've been leading companies for a really long time, is like nobody shows up to work thinking, how can I make this place worse? How can I make it lose money? How can I make all the clients unhappy? No one does that. It just maybe if you're really, really extremely burnt out, your mindset is not allowing you to think positively. That's possible, but nobody thinks that. So I think it's like reframing for leaders that like people generally want to be there, you know, especially in vet med. Guess what? If they didn't want to be there, they could call a vet clinic down the road and have 5 jobs in 5 days, especially nowadays. So it's like, it's embracing that. But, you know, we're over the 30 minutes. It felt like 5 minutes. So let's jump into some of the questions that people that have made time to be here have to ask us. So first one, to be honest, self-care seems like such an added stress. How do you change your mindset to make it important to yourself? You know, oftentimes when they're finished work, they want to go home. Maybe it's 8 o'clock at night because they were there doing medical records all night and they want to go to sleep and they feel like they're on a treadmill. So how do you incorporate self-care as like not just one more thing that you need to do?
yeah. And I think I feel that in my bones because I was there in January of like, I didn't have time. And I think micro moments are important. And I think I've said this a couple of times today, but even if you can do one small thing, again, it doesn't have to be huge, but just one small thing for yourself every day that can really help with getting that ball rolling on kind of the motivation to continue doing the self-care. Because I promise if you start doing one small thing a day, then you're going to feel the effects of like, hey, this kind of feels good. Like, you know, getting some fresh air. Like at 11 a.m. every morning, step outside the vet clinic for 3 minutes and just get some fresh air and take some deep breaths outside. Again, it doesn't have to be big. It could be after a really difficult case, just going to sit at your desk and take a 2-minute break before you jump into the next appointment and just like, you know, kind of recenter. So again, I would challenge, people to think about self-care not as being this huge thing that's heavy in weight and responsibility, but just think about it as I'm going to take 5 minutes today to just do something for me, whatever that might be.
Yeah, I think that's huge. Micro moments.
Micro moments. Yeah, that was from the University of Tennessee Veterinary Social Work. They in their Veterinary Human Support Certificate program, we talk about micro moments. So
yeah, we had a comment from Rhonda. Rhonda, thanks for the comment. Yes, leaders get scared of mental health issues. It's hard to think about, you know, maybe doing the wrong thing. So what's your advice for leaders that like when this thing comes up, you know, somebody's stressed and they're worried about doing the wrong thing? What's your advice if a leader finds himself in that position, Addie?
Yeah, so I think 1, listening, and then 2, leveraging your resources. And I would say 3, getting training on mental health topics, right? So doing things like QPR training, if you are a leader out there, understanding a little bit more about what is suicide and what do I do and how do I react if I see some warning signs, or how do I refer people to mental health resources, mental health first aid and things like that. These are short trainings that often can go a long way with your comfort level of, working with people one-on-one with kind of mental health challenges. I think the dialogue is starting to open up more and more about mental health. And I think that's a great thing, because I think so long mental health has kind of been in the shadows. It's been kind of stigmatized. Like there's definitely this stigma around talking about your mental health or talking about your anxiety or your depression. But I feel like more and more there's kind of this movement towards being more open about it, which is great, because if we can start talking about these really real human issues that pretty much most of us, are living with every single day, it makes you feel not so alone. So I think as leaders, it's important for us to just be open to that other person, being a good listener and just being able to listen, and then asking the person, how can I help you? How can I support you? What are the things that I can do to help support you? Because you don't have to have all the answers. And oftentimes, if we ask people how we can help them, they might have some ideas on how we can help. And then also having those resources handy. So things like your EAP that you're going to establish if you don't already have one. Things like, information on referrals for mental health, and maybe information on, hey, this is the health insurance provider that we have, and this is what the plan covers. So just getting more comfortable with having, I know sometimes these conversations are pretty uncomfortable, but getting more comfortable with having these conversations, because I think we're seeing this movement of people supporting one another, not just in those closed door therapy sessions, but we're supporting one another as human beings, and we can provide that support to one another. So
yeah, I think, the most important thing that I heard you say is you can't screw up by listening. If somebody, if you make the space, we do one-on-ones with everybody in our company. Every leader has one-on-one meetings once a week with their mentee or with their direct reports. And so making time and having conversations and listening, it's an easy thing. You can't screw that up. So listen. And if you don't have the answer, it's okay to say you don't have the answer. Like, let me talk to somebody. Let me see what I can do to help is an easy thing. So another question, and we really appreciate all the questions, and we really, really appreciate you being here for this awesome conversation. So thanks for coming. So it's normal to go to your employer and say, I got a cold, I need a day off, got the flu, I've got COVID. That's happened lots in the last couple of years. But it's not so normal, at least today, to say, like, I'm suffering from extreme anxiety or depression. And you might feel, if you're that person, that it's going to paint you black, or it's going to be something you can't recover from. So what's your advice to people that feel that way, that would rather just call in and say, I've got a cold? What would you tell those veterinarians?
I think it's a personal decision on what you're going to do in that situation. Again, I think the more that we are open about our experiences and vulnerable, like, I think the more progress that we'll make on this issue. And so I think normalizing, I'm going to take a mental health day, like, we need to normalize that, because it's true and it's real. And sometimes you do need to take a mental health day.
It's so funny, Addie. Like, I remember, a month ago, you called me. How are you, Shawn? How really are you? What's going on in your life? And that authenticity that you show up to your friendships with is why people are attracted to be your friends. And so I think that I would kind of throw that message back to the people that are listening. If you show up as your authentic self, you're going to have better relationships with the people that you work with. They're going to know where you stand. And I think it's going to build a better workplace culture.
Yeah. Yeah. And I've gotten more and more open. I mean, it's still uncomfortable for me to admit, like, I'm not okay. And again, I was there just in January. I'm great now, but there was a moment of, like, I'm not okay right now. And I took on way too much, and being able to, it's almost freeing to just be able to be, not overly vulnerable, but reaching out for help to those around you, and really just getting that support from other human beings. And I think, I don't know, I have probably this purity of intent that, we all are good people at heart, and we all want to see each other be okay. So, my key is often being vulnerable about my experiences, and that's gotten me pretty far so far.
So awesome, Addie. So in closing, we've got 50 people on here. What are some great resources that people should go and check out if they so need? And we'll post some on the show notes later, but what are some things that you've come across that you're like, that is a great resource?
Yes. So I would say everyone should get PPR training. So question, persuade, refer. It's recognizing symptoms of suicide and knowing how to respond. And so the AVMA has free QPR training for anyone associated with the veterinary industry. You don't necessarily even have to be an AVMA member, but if you go on their website and go to QPR training, that's a really helpful resource. The Veterinary Mental Health Initiative is another good one. It's an evidence-based resource that does peer groups as well as one-to-one free sessions with a psychologist. So that's something that you should check out. And then check out MentorVet. So we have some resources around us, particularly for the early career and supporting veterinarians in the transition to practice and kind of the first 5 years out. And we have plans to establish programming for other areas of the career as well coming up soon. But yeah, there are some good evidence-based resources out there for some of this mental health and well-being in the profession. And more, I think there's this movement of we're all wanting to support one another. So I think we'll start to see more and more resources going forward for that as well.
Addie, it was such a pleasure to have you.
It was fun. Thanks, Shawn.
It was such a blast. So we'll talk again for much longer. And thanks for everybody that showed up. We're really super happy to bring you these webinars from Talkatoo. Keep fighting the good fight. Be kind to everybody. And thanks for joining me and Addie for our conversation today.
Thank you.